Did you know that tendinitis from arthritis is more common in middle-aged and older adults? The symptoms of Achilles tendinitis include pain in the heel and along the length of the tendon when walking or running, pain and stiffness in the area in the morning, pain in the Achilles tendon when touched or moved, swelling and warmth in the heel or along the tendon, difficulty standing up on one toe, ouch, that nagging ache right at the back of your heel. Hey guys, welcome to Health Protocol Channel, the place where we discuss about all sorts of things. Today we're diving into that frustrating pain at the rear of your heel with foot and ankle expert. So, what's the real story behind that heel pain? Let's get right into it. Quite often, folks come in describing significant discomfort, which can really impact their daily lives. Things like going up or down stairs become a challenge. Even walking can be difficult. You might see them wearing shoes with open backs, or they might have their regular shoes on, but the back part is sort of folded down under their heel. Sandals are also a common choice for them. Frequently, they'll notice what feels like a noticeable bump growing on the back of their heel. What this often is, or can be, is something called insertional Achilles calcific tendinopathy, or simply put, calcifications where the Achilles tendon connects to the back of the heel bone, which is the calcaneus. Now, it's important not to mix this up with plantar fasciitis, where the pain is felt on the bottom of the foot towards the front of the heel. The pain we're talking about is specifically at the back, right where the Achilles tendon, that incredibly strong tendon at the back of your ankle that lets you stand on your tiptoes, attaches to the calcaneus, or heel bone. That's the area where the trouble lies with this particular condition. So, who tends to get this? And what are the usual reasons behind it? Well, it seems to affect middle-aged individuals quite often. Sometimes, people who are trying to stay active, or those whose jobs involve repetitive movements, can develop a lot of irritation at the back of the heel. Essentially, what happens is, there's excessive inflammation in that specific spot. Over time, this can lead to the development of calcium deposits. And that's what creates the bump you might feel. When you mention irritation, are we talking about the tendon pulling on the bone, or the shoe rubbing against the back of their heel? Actually, it can be both. There's the external irritation caused by footwear rubbing and creating friction. But there's also the internal irritation where the tendon itself becomes aggravated by the calcification, or the bony growth that forms at the back of the heel. Right. Okay. And I've heard this used to be called a pump bump. Is that right? Yeah, you can often see it in people who walk, and they develop this quite noticeable, almost golf ball-like bump on the back of their heel. Okay. I guess the name comes from wearing pumps, those high-heeled shoes, which were thought to be a potential cause. That's the theory behind it, yes. All right, so if someone comes to your office with this, what will you do in terms of their medical history and a physical examination? Well, like with any medical issue, the first step is to understand what's causing their pain and exactly where the pain is located. That's the most crucial thing, to determine if it's truly at the back of the heel or on the bottom. We need to make sure we get the diagnosis right. After that, we'll often assess how severe their symptoms are and what treatments they might have already tried. Generally speaking, the initial approach to treatment is usually non-surgical and more conservative. Okay, and will you typically order any imaging for this, like an X-ray? Absolutely, 100%. Sometimes people come in with an ultrasound report. And while ultrasound can be helpful for looking at the quality of the tendon and any inflammation, for me, the most important thing is getting an X-ray of the foot, specifically a view that clearly shows the calcification, the bone structure, and what's happening at the bony level there. And this would be a weight-bearing X-ray, taken not just from the top, but also from the side and the back, correct? Yes, and the side view, that lateral X-ray, is really key to seeing what's going on. Okay, got it. So we've covered what you'd do for their history, the physical examination, and investigations. Now, let's say we've made the diagnosis, and we're moving on to treatment. You mentioned that the first line of treatment is usually non-surgical. What does that typically involve? Well, quite often, people find relief using an anti-inflammatory cream applied directly to the area to try and reduce the inflammation locally. Sometimes, wearing a shoe that's a half size bigger can help to lessen that rubbing effect on the heel. Also, heel lifts, those inserts you put in your shoes, can help to decrease the tension on the Achilles tendon. They might even make you a little taller. Yeah, could give you a couple of extra inches potentially. There you go. And of course, wearing appropriate footwear and modifying your activities are important. If something specific seems to be making your symptoms worse, it's wise to ease off on that activity to reduce the irritation. All right, what about physiotherapy? Yes, physiotherapy can be very beneficial. We aim to stretch the Achilles tendon and reduce some of the inflammation. Sometimes we might use additional treatments like ultrasound therapy, which can help to minimize inflammation at the back of the heel. Some people also ask about shockwave therapy. Okay, what exactly is shockwave therapy? Essentially, it's a type of therapy that uses ultrasound-based technology. They essentially apply pulses to the affected area to try and decrease inflammation and stimulate some kind of soft tissue response. Okay, all right, so does it actually work? That's a good question, one that I've asked myself too. I've had a number of patients tell me that it helped them, so I started looking into the research. The evidence is a bit inconclusive, so I don't necessarily recommend it as a primary treatment. However, sometimes I do suggest that patients could try it, perhaps in combination with their physiotherapy. If it provides relief, then why not? Okay, so those are a lot of different non-operative conservative approaches you can try to manage this. And here, you have 3 surgeons, all saying the same thing. Try the non-operative stuff first before even thinking about surgery. Always, always, always explore non-operative treatments before you consider a surgical intervention. Having said that, let's imagine someone has tried all of this and is just not working. They're really struggling. Are there surgical options available? Yes, once we've exhausted those non-operative routes. If patients are still experiencing significant symptoms, they often say, "Doc, I've tried everything, nothing's helping. You've got to get rid of this pain." Because it can be truly debilitating, right? And I would say that surgery can really alleviate that pain. And patients are generally very happy with the results. The surgery can involve a couple of different approaches. Firstly, if we're primarily dealing with that Haglund's deformity, that bony bump, we can often address it arthroscopically. This involves making a couple of small poke holes, using minimally invasive techniques with a scope, and we essentially shave down the bony bump in front of the Achilles tendon. And that's different from how it used to be done, right? They used to have to make a large open incision, correct, because we simply didn't have the technology for these minimally invasive approaches back then. So, that arthroscopic technique is really for addressing the Haglund's deformity itself. However, sometimes patients have pain not just from the bump, but also deeper down where the Achilles tendon attaches. In those cases, we can't really address it arthroscopically. Yeah, because you'd risk damaging the tendon, which wouldn't lead to a good outcome, right? So, that's when we might consider a more open procedure. What does that involve? Yes, it's often a mini-open procedure, meaning a small incision, about 3 centimeters, on the back of the heel. There are different ways to do it. Sometimes we might carefully split the Achilles tendon to access the area, find that bony bump and the calcification, and then remove it using a burr or a small saw. We smooth everything down and then repair the Achilles tendon. In cases with larger bony growths and significant spurring, we might need to detach the entire Achilles tendon. We then carefully remove all the bony spurs and smooth out the back of the heel, also cleaning up any inflamed tissue on the Achilles tendon. Finally, we reattach the Achilles tendon using small, absorbable anchors. And actually, for all you basketball fans out there, this is similar to what Larry Bird had in the late 80s. Though, I'm sure they used a much larger incision back then, for sure. So again, we always try to minimize the size of the incisions on the back of the heel. After the surgery, patients are usually in a cast for about 2 weeks, during which time they can't put any weight on that foot. Then, we transition them to our post-operative protocol, where they can start walking at 2 weeks with an air boot and heel lifts. We gradually reduce the height of the heel lifts every couple of weeks. Larry Bird wore a lot of pumps back in the day, didn't he? Yeah, I think he mostly wore those bad Converse shoes. You look at the shoes those guys wore in the 80s. Jordan probably blew out his first pair just doing a jump shot. Exactly. So, although bad things can happen, the risk of something serious occurring is generally very, very small, and your surgeon will take precautions to minimize those risks. However, it's important to be aware that these risks do exist before you decide to proceed with one of these elective procedures. And I think it's also important to recognize that these are often chronic problems, so they're not going to be resolved overnight. So, what would you say is your standard approach for non-operative treatment? How long do you typically give it before considering surgery? Usually, I'd probably say about 2 to 3 months, give or take. And often, you want to try a combination of different things, maybe approaching it more aggressively with a multimodal approach. If that's successful, then that's the best outcome. You're not rushing into anything. No, and if you do end up having surgery, and it's very successful, try not to think, oh, I should have done this a long time ago. You shouldn't have. You really do need to try the non-operative treatments first, because the chance of getting better with those methods is often very, very high. Even if you didn't get better with non-operative treatment, and unfortunately needed surgery, there are probably many other people who did improve with those initial treatments. That's why surgery isn't the first step. The other thing I'd say is that a lot of the research on joint replacement satisfaction shows that the longer you've suffered with the pain, the greater your relative improvement feels, and therefore, the happier you tend to be after treatment. So, while we don't want you to suffer for a long time, that experience can actually make you value the improvement even more. Yeah, we can always do a surgery, but we can't undo it. That's right, I like that. Well, that's a really good overview of heel pain at the back of the heel. So, if you found this video helpful, please give it a like, subscribe to our channel, and feel free to share your comments or experiences with Achilles tendinopathy below.